Hello everyone, I'm Millie Swan, a Vice President here at Forest Health, and joining me today I have Dr. Brian Batson, who's CEO with the Hattiesburg Clinic, and Dr. Steve Farrell, who is the Chief Medical Officer at Forest General. Thank you for joining us today. A lot of questions around young people, getting the vaccine, 12 years of age and older. I can understand, we're all parents here, and so that's a lot to consider. But we've seen an increase in pediatric patients that are getting COVID. So anything that you can state, Dr. Batson, that might alleviate some of those fears for them to consider?
Sure. As we know, the Pfizer vaccine is approved down to age 12. There are additional studies going on right now with multiple vaccines for children younger than 12. It is certainly something for parents to talk with their children about and talk about the risks and benefits of these vaccines. We recognize that COVID does not just affect the parents, it affects the children. And we also know that children have had an increased risk of hospitalization or a rise in hospitalization over the last few months as they've become more likely to be infected with the spread of the Delta variant. As a parent, this is a discussion we had with our children and talked with them about the pros and cons of vaccination, made that choice together, and they chose to become vaccinated.
Yes, well, it is something definitely to be considered with back to school now, just a lot of things and kids getting together. And I know, like I said, it's a scary thing, but you do need to get all the information you can. I know Dr. Anita Henderson's done a great job, a pediatrician with
yes,
the Hattiesburg Clinic,
Dr.
putting
Henderson,
information out there.
Absolutely. Dr. Henderson is the president of the Mississippi Academy of Pediatrics. She also points out that we are now seeing long-standing effects of COVID in children. Up to 10 to 30% of children will continue to have shortness of breath or other symptoms months after they had COVID. We certainly want to prevent those things from happening.
Yeah, and definitely a switch from what we heard early on, the older population, and a lot of those, of course, were vaccinated, so now seeing it with the younger people as well. Another question that comes up quite often is, can the vaccine lead to fertility issues? I know that there are a lot of parents who have young teenage, daughters, and that's something that is talked about a lot too. So,
and Millie, I'm not sure of the origin of that bit of information, but it has been very clearly scientifically debunked. There is no risk to the fertility of a young lady, a young woman, from taking the vaccine. That has been spoken about in many different circles, and our obstetricians here have remarked on that, and they recommend it for everyone down to age 12, and there's absolutely no scientific evidence. There's a lot of chatter in social media regarding that, but no scientific chatter, nothing that's of science or of substance.
Well, hopefully that'll alleviate some fears too, and maybe we can stop some of those myths, because it is circulating, to your point, very much out there on social media. And another question, of course, that circulates a lot is pregnant women. Mm-hmm. Should they receive the vaccine? Expectant moms. And again, I totally understand that fear. I have a new granddaughter. My daughter did take the vaccine, but a lot of fear out there about that. So can you give us any information about that?
In fact, the American College of Gynecology just yesterday, I believe, made reinforcement to their recommendations that COVID vaccines should be given to pregnant women regardless of their gestational age, regardless of which trimester. That was supported by the Society of Maternal Fetal Medicine. So the two societies that guide our recommendations for pregnant women, what is the best guidance for them, and they clearly say that vaccines should be given regardless of the gestational age. What we do know, and contributing to that, is the fact that pregnant women who have COVID are at significant risk for poor outcome. Even further reason for pregnant women to become vaccinated.
And I think there is some research maybe also that supports that there could be benefits, right, to the baby.
Yes.
If the mother is
there
vaccinated.
There is absolutely some consideration that it may benefit the baby as well.